Hi, and welcome back. Today we'll be going over the inhaler Tudorza Pressair. The generic name is Aclidinium Bromide Inhalation Powder. Again, my name is Robert Yang, and thank you for joining me again. So the first part, I will be going over the patient education. Before understanding what Tudorza is and how to use it, let's look at the disease state that it's used for. So what is COPD? This is chronic obstructive pulmonary disease. This is a group of diseases that cause airflow, blockage, and also breathing problems. It includes emphysema and chronic bronchitis. Some symptoms include frequent coughing or wheezing, excess phlegm or mucus production, shortness of breath, and trouble taking a deep breath. In the United States, tobacco smoke is a key factor in the development and progression of COPD. Exposure to air pollutants in the home and workplace, genetic factors, and respiratory infection also play a role. Some groups are actually more likely to report COPD. This includes women, people aged 65 to 74 years, American Indians, Alaskan Native, and multiracial non-Hispanic. People who were unemployed, retired, and unable to work, people with less than a high school education, and current and former smokers. Now that we understand what COPD is, let's look at the medication, Tudorza Pressair. So what is this medication? This is a prescription medicine to treat COPD. However, this is not a rescue medicine and should not be used for treating sudden breathing problems such as asthma. It may be used alone or with other medications such as albuterol, the rescue inhaler. What are some important safety issues? Do not use if you have a severe allergy to milk proteins or to aclidinium bromide. Tell your doctor about all your medications, including if you have glaucoma, prostate or bladder problems, or problems passing urine. Tudorza Pressair can actually make these problems worse. Tell your doctor about all the medication you take, including prescription and non-prescription medicines, eye drops, and vitamins, and herbal supplements. Especially tell your doctor if you take any other anticholinergics or atropine. Seek immediate medical help if your breathing problems worsen while taking this medication, and it is not known if this medication is safe in children. Let's look at the picture of the Tudorza Pressair. So you have the protective cap. This is to protect any foreign objects from getting inside. You have the green and the red control window. Red means you inhale your medicine correctly, and green means that it's ready to go. You have a green button in the back. This is the button you will press down to actually release the medication and inhale. And the dose indicator actually tells you how many dose is still remaining inside. Let's look at how to use the inhaler more closely now. First things first, you want to wash your hands. Make sure you have clean hands. Open the sealed bag at the arrow marking and remove the inhaler. Then you want to write down the date you opened the sealed label of the inhaler. You can discard the Pressair inhaler 45 days after the date of opening the bag that the inhaler comes in, after the marking 0 with the red background shows in the middle of the dose indicator, or when the device locks out, whichever comes first. Do not press the green button until you are ready to take a dose. Remove the protective cap by lightly squeezing the arrow marked on each side of the protective cap and pulling straight off. Look into the opening of the mouthpiece to make sure nothing is blocking it. Then look at the control window. The control window should be red. Now hold the inhaler horizontally with the mouthpiece facing you and the green button on top. Press the green button all the way down. The control window changes from red to green. Make sure the green button is on top. Release the green button. You want to make sure you release this so the inhaler can work correctly. Make sure the control window is now green. If the control window is still red, then the dose is not prepared. Go back to the first step. Hold the inhaler away from your mouth and breathe out completely. Never breathe out into the inhaler. Hold your head upright, put the mouthpiece between your lips, and close your lips tightly around the mouthpiece. Take a deep breath in. Keep breathing in for as long as possible. However, do not hold the green button down while inhaling. A click will let you know that you are inhaling correctly. Take the inhaler out of your mouth, hold your breath for as long as possible, then slowly breathe out away from the inhaler. Make sure the control window is not red again. Some people may have a grainy sensation in their mouth or a slightly sweet or bitter taste. Do not take an extra dose if you do not taste or feel anything after inhaling. If the control window is still green after inhaling, then this means you have not inhaled your medication correctly. Once you have inhaled correctly, put the protective cap back onto the mouthpiece. You're probably wondering, what do you do if you accidentally prepare a dose? This means you probably pressed the green button on accident. You want to store your inhaler with the protective cap in place until it is time to inhale your medication. Then remove the cap. From here, please refer back to the previous steps in the previous slide of how to actually use the inhaler. How does the indicator work, or how do you read it? The dose indicator shows a total number of doses left in the inhaler. On the first use, every inhaler contains at least 60 doses. Each time a dose is loaded by pressing the green button, the dose indicator moves by a smaller number. When the red band appears in the dose indicator, this means you are close to the last dose. When the marking 0 with the red background shows in the middle of the dose indicator, or if your inhaler is empty or locks out, or 45 days after the day you open the sealed bag, whichever comes first, then you must throw this away. Or another way, how do you know if the inhaler is actually empty? When the green button will not return to its full upper position and is locked in the middle position. Even though the green button is locked, your last dose may still be inhaled. After that, the inhaler cannot be used again, and you should start using a new inhaler. What should you expect from taking this medication? Some adverse effects that needs medical attention include sudden breathing problems, new or worsened symptoms of increased pressure in your eyes, new or worsened urinary problems such as difficult, painful, or frequent urination in a weak stream, serious allergic reactions that include rash, swelling of the face, lips, tongue, or throat, and itchy. And then some common side effects that does not need immediate medical attention include headache, common cold symptoms, cough, and nausea. What happens if you miss a dose? Skip the missed dose and go back to your normal dose. Do not take 2 doses at the same time or extra doses. How do you clean and store this medication? Never use water to clean the inhaler. Water can actually damage the medication. Only wipe the outside of the mouthpiece with a dry tissue or paper towel. Store at room temperature between 68 to 77 degrees Fahrenheit. Keep it in a dry place. Do not store it on a vibrating surface, and keep out of reach of children. Now this next part, I'm going to be going over the prescriber education. So it is a long-acting antimuscarinic agent. This is also an anticholinergic agent, and the price for each costs $373.75. The recommended dosage in adult is 1 inhalation BID. Again, this is not used in children, or there has not been any study done in children. For the mechanism of action, it has similar affinity to muscarinic receptors M1 to M5. In airways, it exhibits pharmacological effects through inhibition of M3 receptors at the smooth muscle, which leads to bronchodilation. The bronchodilation following inhalation is predominantly a site-specific effect. For the pharmacokinetics, the distribution is 300 liter. Metabolism is rapid and extensive hydrolysis via plasma esterase to inactive alcohol and acid metabolites. The bioavailability is 6%. Half-life elimination is 5 to 8 hours. The time to peak is within 10 minutes, and in the excretion, it is in the urine, less than 1% each of an inhaled dose. Some medication safety issues. Aclidinium may be confused with Clidinium. Tudorza may be confused with Tordo or Truvada. Pressair may be confused with Provera or Premacor. For the contraindications, This includes hypersensitivity to aclidinium or any component of the formulation, and severe hypersensitivity to milk proteins. Reproductive and pregnancy considerations. For the pregnancy considerations, adverse events have been observed in animal reproduction studies, but not human. Breastfeeding consideration. It is not known if aclidinium is present in breast milk. Decision to continue or discontinue breastfeeding during therapy should be take into consideration the risk of infant exposure, the benefits of breastfeeding to the infants, and the benefits of treatment to the mother. Drug interactions. In vitro studies suggest limited potential for CYP450-related metabolic drug interactions. Concurrent administration with sympathomimetics, methoxanthine, and steroids show no increase in adverse drug events. For the anticholinergic, there is a potential for additive interaction with concomitantly used anticholinergic medications. Therefore, avoid co-administration of Tudorza Pressair with other anticholinergic containing drugs, as this may lead to increase in anticholinergic effect. And here are my references. I hope you learned something new today, and be on the lookout for my next video. Take care. See you soon.